If you're taking high cholesterol, stop scrolling. Dr. Don here from the Wellness Way, South Jordan. Why are you taking your cholesterol medication? Well, you're taking your cholesterol medication because you're being told that the lower cholesterol you have, the lower your risk is for heart disease and heart attacks. Well, what if I told you that more than 40% of the people having heart attacks have low to normal cholesterol? See, they did a study back in 2002, and it was the last study of its kind because the results of this study goes against what the American Heart Association and the big pharma companies want us to believe. See, they followed people that had familial hypercholesterolemia, cholesterol levels 2-3 times the normal range. They followed these people between their 60s and 70s, the prime age for having heart attacks. They followed them for multiple years, and the results showed less heart disease, better mortality rate, and their cholesterol levels were through the roof. See, we have to understand it's not how much cholesterol you have in your bloodstream that determines your risk of a cardiovascular incident. We know, regardless of what kind of doctor you are, no doctor will ever argue with me when I say that inflammation drives all disease. See, there's a marker that they run on you to look at systemic inflammation. It's called a CRP, C-reactive protein, or cardiac reactive protein. And below the results of that test, it will tell you 0 to 1, low risk for a heart attack. 1 to 3, moderate risk for a heart attack. But above 3 is a high risk for a heart attack. Now, on your cholesterol numbers, do they tell you your risk of heart disease or a heart attack based off of your cholesterol numbers? No, because it's not how much cholesterol you have. It's how much inflammation do you have associated with that cholesterol. Remember, guys, if more than 40% of people that are having heart attacks have normal to low cholesterol, it is not the amount of cholesterol that you have, okay? Cholesterol has been made out to be the bad guy. Did you know that cholesterol is actually a vital nutrient? We cannot live without it. And when our cholesterol levels start to drop, we get a lot of systemic issues because cholesterol does so much for us. Low cholesterol has been linked to things like dementia, Alzheimer's, Parkinson's disease, gallbladder issues, low vitamin D levels, right? Because cholesterol affects all of these things. What's a major side effect for men taking a statin drug? Erectile dysfunction. Why? Because if you don't have cholesterol, you can't make any hormone in your body, including testosterone. All these postmenopausal women that have all of these hot flashes and weight gain and mood swings and depression because their cholesterol levels are so low, their hormone levels are so low. Guys, cholesterol is not the bad guy. Cholesterol is essential. You need to do the proper testing to make sure that your LDL particles are not shrinking down to small, dense LDLs. What causes those LDLs to shrink down to small, dense LDLs? It's inflammation. Is your doctor checking your dense LDL3s, your dense LDL4s, and your lipoprotein small a? Of course they're not. Why? Because a statin medication cannot stop those LDLs from becoming small, dense, harmful particles. The only thing a statin medication does is decrease overall cholesterol production by your liver. Remember, your liver makes 80 to 85% of the cholesterol. So when your cholesterol starts to go up in your blood, it has way more to do with your liver doing it and way less to do with your dietary cholesterol. Guys, like and follow for more information about heart disease.